Hi John, I'm here to share the results of the BDI test that you took the other day. First, I would like to explain to you what the test is about. BDI-2 stands for the Beck Depression Inventory. This is an inventory for the assessment of depression. It explains in the textbook according to Hayes, 2013, this test first replaced the BDI. Furthermore, according to Hayes, on page 151, explains that the version of the test that is currently being used reflects the current criteria of depression. One interesting fact about this test, according to the author, is that the test is able to detect depression in kids as young as age 13. The BDI includes 21 items that describe symptoms of depression of an affective, cognitive, or physiological nature. Each item uses a 4-point scale of severity ranging from 0 to 3. Clients mark the level of severity for each symptom that best describes how they are feeling over the past 2 weeks, including today. This test, according to the author, can be used in 5 to 10 minutes, so the counselor tallies up the scores, and it can be done in the first session. According to Beck et al. 2003, scores on the BDI-2 are internally consistent for college students and psychiatric outpatients that are subject to change over time. And the BDI-2 was developed to be highly sensitive to changes in mood over short periods of time. If people experience significant changes in their lives or they are responding positively to a counseling program, their BDI scores reflect these events. Validity scores indicate that the BDI-2 scores effectively differentiate depressed and non-depressed individuals. Beck et al. 2003. Scores on the BDI-2 correlate highly with clinical ratings of depression. John explains in the manual for the BDI-2 that the scores can be interpreted as follows. 0 to 13 is minimal depression. 14 to 19 is mild depression. 20 to 28 is moderate depression, and 29 to 63 is severe depression. It explains in my textbook on page 152 the above scores are what Hayes, DG, 2013, page 152 refers to as being called general guidelines. So now I'm going to tell you about your results. John, your score is 32, which falls within the range of severe depression. So I'm really concerned about you, and it says in my book, as a general rule, if the score exceeds 28, especially for 2 administrations of the BDI-2, separated by 2 weeks, the counselor should consider referring the client for psychiatric evaluation and possible medication. Within the report, John, you stated the following statements according to the report. According to the report in front of me, I would kill myself if I had the chance. So I am concerned about this, and according to this report, you have an imminent risk of suicide. However, in contrast, on the other report, you stated the following: I have no desire to kill myself. I would try to save my life if I found myself in a life-threatening situation. I would like to know how you really feel about the answers to these questions, so we're going to talk about that. Based of the results of your assessment, states in the report in front of me the following: elevated levels of depression, hopelessness, and anxiety indicate that John Sample is experiencing considerable distress. He may be feeling rejected and experience feelings of anxiety, and life does not hold a lot of hope. So, the plan that I have is that I would like you to retake the assessments that you took the other day, and I feel it is necessary for me to check with my supervisor about what the best plan is. I think that it would be a good idea to refer you for a psychiatric evaluation if your score is greater than 28 again. Finally, we must establish our safety plan. So next I need to find out the following information from you. These are the questions that I would ask John Sample. Do you have a history of impulsive behavior Or do you do things at the spur of a moment? Have you ever cut yourself? Do you use alcohol or drugs? Do you drink and take pain medication for sleeping pills? Do you have any current health problems? Have you lost a loved one recently? Do you have a history of mental illness? Do you have access to guns or weapons?